order aimed at limiting the damage of COVID-19. We had no idea what to expect. I do know that none of us, or at least I can speak for myself, I never expected all of this. Earlier today, I signed what I expect to be one of my last executive orders regarding COVID-19. This new order removes all of our county mask mandates and allows businesses to operate at full capacity without state-imposed rules or restrictions. If businesses or individuals decide to take additional precautions, they are absolutely within their rights. In fact, it may be smart. But we are not going to continue to use the heavy hand of government when it is no longer justified by the reality we see around us. Our hospitalizations have plummeted, and our case numbers have also fallen dramatically. In fact, our case numbers have fallen to the point where no county currently meets the original criteria that we put in place for a mask mandate. When our new order goes into effect, we will have done more than 700,000 vaccinations, targeting those who are most vulnerable amongst us to this virus. The majority of Mississippians over the age of 65 will have received at least one dose. I originally signed these orders, and I made very clear what my goals were. It was never to prevent all possible spread of COVID-19, because we viewed that as unrealistic. But it was always about protecting the integrity of our healthcare system. We wanted to ensure that it would never be overwhelmed with COVID patients, so that anybody who needed quality care and could get better with quality care received that quality care. I understand that in many parts of the country, the goalposts have shifted. But for me, that goal remains the same. Now, let me be clear. There is still risk to unvaccinated individuals who choose to interact with others, just as there has been throughout the last 12 months. There will still be COVID in our communities, perhaps for a significant amount of time in our state as well as across the country. We will all need to decide for ourselves and our families how to assess the risk and rewards of each and every activity we choose to pursue. But the risk of overwhelming our hospitals with severe COVID cases is coming to a close and gets less and less every single day. We see more and more of our people, particularly those most vulnerable, vaccinated. That is because we have a new, better tool to combat COVID. Executive orders that interfered with people's lives were the worst, but the only possible interventions for most of the last year. You've heard me say this many times before. I never took any pleasure in signing executive orders. I did it because I believed it was the right thing to do for our people at that time. But now we are putting all of our focus towards the rapid distribution of the vaccine, and the governor's office is getting out of the business of telling people what they can and cannot do. Let's be honest. Throughout the last year, we as a state have been among the 4 of 5 most open states in America. And we've been rewarded for it with more jobs, a stronger recovery, and more economic activity. But that's not because the measures we put in place were a light burden. It's because the measures in the rest of the country were so harsh. We all need to recognize that none of these orders in our state or any other state are anything short of unprecedented, particularly when you think about the length of time we have been holding these very press conferences. We know that these orders have to end, and I have said repeatedly that these orders have to end at the earliest possible moment. By and large, this is that moment. Having said that, I also want you all to know that I am replacing our current orders with recommendations. Everyone in our state should continue to listen to Dr. Dobbs and our other health advisors for the best possible wisdom regarding how you can personally avoid any risk of catching COVID. You should continue to listen when we advise you as to the measures that can be taken to minimize that risk to you and your family. Their insight is valuable. Now, the only rules that will remain in place in this order are with respect to our K through 12 schools, as well as capacity limits of 50% on indoor arenas. I want to talk a little bit about why I chose to leave the measures in place with respect to K through 12. I chose to let them stay because I believe that the most consequential debate playing out in America today is whether children should be in the classroom learning. My view is simple. All of Mississippi's children should be in the classroom. All of America's children should be in the classroom. It truly breaks my heart to see other states to continue to force children to stay home and miss out on a quality education. For many of those kids, being out of the classroom for well over a year may be an obstacle that they can never overcome. I pray that is not the case. I'm thankful for the teachers. I'm thankful for our administrators. I'm thankful for the people in our schools who have gone above and beyond since the first week in August when we opened schools in Mississippi. It's not been easy. In fact, it's been very hard. I know that. But I also know that there's a generation of kids that are going to be better because of our willingness to make hard decisions to allow them back in the classroom. I want to make sure that I say this. I don't want to give anyone an excuse to act like those other states. So that is why I am not rolling back the restrictions, either mask mandates or otherwise, in our K through 12 schools. In my view, this is the way forward. As more and more people are vaccinated, there will be more and more immunity throughout our state. This is a far better way to flatten the curve and prevent our healthcare system from being overwhelmed. Please, though, continue to use your best judgment. Please continue to look after your loved ones. There is no replacement within the government for good common sense. Simply because there is no longer an order in place doesn't mean it doesn't make sense to continue to take necessary precautions. I want to thank everyone again for being here today, and I want to turn it over to Dr. Dobbs to give us an update on where we are, and particularly the exceptional good news that we've both gotten over the last several days with respect to the third vaccine, which is going to allow us to distribute even more quickly. Dr. Dobbs, thank you.
No, thank you very much, Governor. So today we're reporting 301 additional cases, but 44 deaths. A stark reminder that we're still seeing significant coronavirus transmission and deaths. So we're not out of the woods, so we still need to be careful. We are fortunate to have new tools. We have vaccines available that are highly effective, not only at preventing illness and severe illness, but growing body of evidence that it does also prevent transmission, further reinforcing how important it is for folks to get vaccinated. We're putting out new public health guidance that very clearly outlines for people over 65, or if you're someone with a chronic medical condition and over the age of 16 that puts you at higher risk, we are strongly recommending that you do not attend any social activities or any mass gatherings at all until you get vaccinated. All of these folks are eligible to be vaccinated, and if we want to really have an impact on our hospitalizations, morbidity, and mortality, we need to make sure that we get as many vulnerable Mississippians vaccinated as quickly as possible. So where do we stand on that score? And I think on some measures we're doing extremely well. If we look at people who are 75 years of age and older, 50% have received at least one dose of COVID vaccine, and a large proportion of those are fully immunized. If we look at people 65 and older altogether, we're at about 45%, so we're making good progress, but we're not there. We want to protect everyone who's most vulnerable, so before we start opening up a little bit on a personal basis, please get vaccinated before you do any mass gathering, including church, funerals, sporting events, weddings. Get vaccinated, get protected. The same thing goes with when we look at younger folks who have chronic medical conditions. Please get vaccinated. We have a pretty broad criteria of who's eligible to get vaccinated right now. It includes everyone over 65, people with a whole host of high-risk conditions, over 16, first responders, public safety, healthcare workers, and teachers, and also in daycare. So it's a lot of folks. So please get vaccinated. We are making great progress in getting vaccine out there. We've done well over 600,000 vaccinations, and that is growing daily. We did over 132 vaccinations last week, and if we do less than 150,000 this week, I'm going to be very disappointed. So that's the kind of performance we need to expect going forward over coming weeks, and that makes a big dent as we kind of go forth. We're also making great strides in our health equity work. We have identified very clearly that African Americans were very much under-vaccinated as a proportion of the population, with the lowest weekly value being at 13.5% of vaccine utilized. And that's in a state with a population of about 38% African Americans. But just this week, we logged 30% of vaccines going to African Americans. So you can see that we've almost tripled our impact in the Black community. So that's something we'll continue to work on until we get to really where it needs to be, where there's true equity. We're still working aggressively with our Hispanic or Spanish-speaking population. We're still lagging, and also in regular communications with our friends at the Mississippi Band of Choctaw Indians to make sure that they're protected as well. We do have a new tool available now. We have a new vaccine, Johnson & Johnson, also referred to as Janssen vaccine. It's a collaborative effort. It's a single-dose adenoviral vector vaccine that has been shown to be highly effective at preventing severe illness and death. To be clear, it does not show the same efficacy at preventing any symptomatic illness, but where it counts, it looks good. And even with the variants that have been identified in South Africa and other places, there is still some significant residual protection. So we're very excited to have this in our tool chest. Again, a single dose with easier storage characteristics. We have been allocated 24,000 doses of vaccine this week of the Johnson & Johnson. Of those doses, 8,000 are going to be allocated for special drive-through events. We're adding additional clinics this afternoon for people to go ahead and get vaccinated with the one-dose Johnson & Johnson. you will be able to select a Johnson & Johnson location. So if you want to get that vaccine, you will choose that vaccine on that Johnson & Johnson day. And if you'd rather have Pfizer or Moderna, then you can choose one of the other dates and locations. So please, it's a choice. We're also sharing the additional 16,000 doses with partners throughout the state. This week, we're going to share our vaccine to 101 additional partners, in addition to the locations that the federal government has chosen with the federal pharmacy program. Even now in the state of Mississippi, there are 188 locations where people can get vaccinated across the state of Mississippi, and that excludes the drive-through locations. More and more places are becoming available to get vaccinated, so please go to healthyms.com, look at our COVID vaccination page. We have a vaccine finder. We're going to continuously update it so more and more people will know where and how to get vaccinated. And that's all I have, Governor.